comes to OET speaking on exam day, all of you,
Doctor,
I'm hoping you all are. Yes.
excuse me, doctor. I can't read this. You have sent a paper. It's not very clear. It's blurry.
All right,
Is it
I'll
going
send you. I'll send you the file. I'll send you the whole file. Don't worry about it. I'll send it to you. All right. So what I was saying is that on your exam day, don't worry, I'm sharing a copy. On your exam day, you're going to have two cards that you're going to do, right? You're going to do two cards on your exam day. Each card is going to be of 3 minutes. 3 minutes would be your preparation time for the card and 5 minutes for the performance, right? And there would not be any video that's going to be recorded. The person who is taking your exam is just there accompanying you and doing the role play. They're not grading you. They're not marking you. They are not judging you in any sort. They're just there to help you out with the conversation. Your real test is in what you say, the tone that you use, the words that you use, the politeness that you have in your conversation. That's what matters on your exam day. Because I'm sure we all are doctors in here. Most of the scenarios that you read uh, on these cards, they're very familiar to you, like Parkinson's, urea, we know that. So that's the exam is not your medical exam. Your medical exams are USMLE, Lab 2, CS. Those are your exams. This is not your medical exam. This is your English exam. And in that too, it's not a very literary exam. They just want to see if you're able to do communication with the people who would be coming to you in your particular field, in this case you being doctors, right? So I hope these things are clear, because once you understand this, it's really important. I know it's very superficial, but it's really important that you understand this, because when we start this OET preparation, we get really stuck in what should I be doing? Should I read the topic? Should I read the scenarios? Should I be reading the grammar? No, we don't have to read that. What we have to do is we have to just understand certain tips, certain tricks, certain criteria that OET wants you to have while you would be dealing with the patients in the country, wherever you go, whether you're going to the US, whether you're going to UK, whether you're going to Australia. These are the requirements that they want you to have while you would be dealing with the patients, right? So for speaking, there are 3 things that you need to know. I'm just going to share my screen so that you can see what's going to happen. Any questions if you have so far, you can always ask at any time, right? Any questions at all, you can ask at any time. Right, so I'm just going to share my screen now. Can you guys see it?
Yes.
Okay, that's great. Okay, so there are 3 things that you need to know when you'll be doing OET speaking, right? For speaking, right, you need 3 things. The first one is empathy. Can anybody tell me the difference between empathy and sympathy? What is empathy? Like, what do you think is empathy?
When you support the patient, like let's say the patient tells you that he has like pain or whatever, so you kind of give him empathy and like, I'm sorry, I'm here to help you, something like that.
Something like that. But then that's also sympathy, right? Empathy and sympathy are very similar, but we doctors, we have been taught in our training that you are supposed to be empathetic with any patient that comes your way. Whenever you go to a funeral, you do have sympathy for someone who died, but you do not have empathy. Sympathy is when you feel sorry for someone. Empathy is when you really feel what that person might be going through and you provide them support. Right? Like when you'd be doing your conversations in OET, you'd be saying, I'm sorry to hear that. I'm sure it must be really difficult for you. This is where your part of sympathy is. But when you put them in, when you put yourself.
Understand by empathy is, the ability to understand and share the feeling of somebody, and
Yes,
the other person can feel that, yeah, this person is like able to connect to that, to him or her.
that's what
And
it is. Like
sympathy is
you feel.
something when you feel
Yes,
sorry for somebody's loss or something.
definitely. That is when you feel like you are in that person's shoe. That's literally what it is. literally what empathy means, right? Like you are in their shoe. That's what empathy means. When you were going to, because this is a very difficult concept to understand, because you get mixed up in there. They do sometimes write in the cards that you should sympathize with the patient or empathize with the patient. They go hand in hand. But when you'd be doing speaking, you have to actually personalize your speaking into empathy. How would you do that? You would be first giving them support in words, right? Like you said, that you'd be supporting them. Along with giving supporting words, you do offer support in the literal sentence that you'll be using next. Right? For example, the person comes up to you when they're having pain or they have got a thorn in their foot, and you're saying, I'm sure it must be really difficult for you. You must be in a lot of pain. That's not where you end, right? We do empathize. We do make them feel that we understand what they're going through, but we provide them support by saying, as doctors, that do not worry, I'll be here for you and I'll make sure that you receive the best treatment, right? That's where your whole conversation starts from, right? That's number one. The number one thing that you need to know about OET speaking is empathy, because the rest of it is, I'm sure you guys understand English. I'm sure you guys can speak it. So there's nothing much to teach you about English, but there are certain things that I want you to know. The first thing is empathy. The second thing is clear communication. Can anybody tell me what communication means? Like, what do you mean by communication? Like, in your raw words, in your own words, anything that you know about communication, what would that mean?
Communication is a two-way process. You communicate and you understand the other person, vice versa.
Right, that's true. It literally means coming. It literally means to understand, right? Like if I talk in an accent that you don't understand, or if I talk in a language that you don't understand, even though you know the language, but you do not understand it. By understanding, I mean you make them know the meaning of what is happening. That is your communication. By clear communication, I mean that you should know three things when you'd be doing the tasks. That's number one, you understand the task. Right? You make the person next to you understand the task, right? You know the task, you make the person understand the task, and whatever you say is in a clear accent, right? Accents do not matter, but clear accents, clear speech, right? And clear voice. All right, these three things are really important when it comes to speaking clearly or having a clear communication. Whatever you say, you understand the task, the person next to you understands the task, and what is left. Your pitch also matters when it comes to OET speaking. I know that this sounds like a vocalization class, but it isn't, because here what matters is that whatever you say, the person, because your voice is getting recorded, so you need to be very clear, and the person sitting next to you or the person in front of you are not taking your exam. Those who listen to the recording, they'll be recorded in front of you on your exam day. Those people would understand any mistakes that you've done, even though they're not very cutthroat, but you have to be very clear in what you say. Is this clear? These two things are really, really important when it comes to OET speaking. Is this clear? These are really superficial points, but really, really, really important. Then third thing that you have to know is having continuity in your speech. Continuity, right? Continuity. By that I mean is that you commence, right? You commence the speaking, you continue the speaking, and you make sure that it's being carried out in a professionally polite way. Professionally polite way, right? Because see, this is not just speaking, because the speaking is also done in IELTS, right? This is occupational English test. That means that your words, your voice, your tone, your tone, your voice, your words, they should be carried out in a professional way. They should be polite in a professional way, right? So you're not going to talk like I'm wanna, or you're not going to go with hello, or you're not going to use words like assalamu alaikum, or some informal words. Your conversation is very formal. So these three things are really, really important: empathy, clear communication, continuity in your speech, where your speech is commenced by you. You start the conversation. You make sure that the conversation keeps on happening. So I'll tell you the tricks and how you keep on making the conversation happening. All right. Are all these things clear to everybody?
Yes.
Yes, doctor.
Any questions, please? Questions? No? Should I move forward? Okay. So now what we're doing is I would want you to look at the card that I've shared, the file that I've shared. The first card is on Parkinson's, right? This is one of the cards from OET deck, right? It's from the future length file. I've taken it from there. So what I want you to do is I want you to open that card, and you all have 3 minutes to read just the part of doctor, because on your exam day you would be having 3 minutes. As I said earlier, you would be having 3 minutes to read the card and 5 minutes to perform the card, right? So I would want you to read it, and I gave you guys exactly 3 minutes. Is that okay with all of you? It's 9:08 on my clock, so at 9:12 I would want you to stop. Okay? Everybody found the card on Parkinson's?
Yes.
Okay, you guys have 3 minutes. Yes, that's the first page. The first page where Parkinson's is written, that's what we're doing.
Just the doctor part.
Yes, just the doctor part, because on your exam day, you're not going to be doing patient's part or the caretaker's part. You're going to be the doctor. So I would recommend that whenever you're practicing, make sure that you do the doctor's part only. Don't go for patient's part, because otherwise you would mess it up.
Oh, I read many doctors. I thought we had read all this. Okay.
No, not like that, not like that. This is why I've taken this orientation session, so that you can understand what's happening, all right? So you have to just read the doctor's part. You guys have 1 minute more. Should we start? I think we should start, all right? So I'm going to start reading the part where the patient's here. I hope you can see the screen, and I hope it's very clear. hopefully. If not, then you can look in the PDF file that are provided. So I'm going to start by reading the doctor's part first, right? Because we're going to be doctors. So you have to notice when you're doing your exam, you have to notice three things. The first thing is what kind of setting it is. So in here it's written that it's a suburban clinic. That would mean two things, that either it's a GP clinic or it's a surgery, right? So because this whole exam has been developed by Australian council mostly, and those follow UK protocols, so they call surgery as the GP's clinic, right? So it's basically just a clinic where there's a doctor who is having a qualification of a general practitioner. That's not a specialized clinic, right? So that's your first thing, what kind of setting it is. You have to make sure that you understand the setting, because that is where your introduction begins. After that, you'd be looking at what kind of card it is. If it's a regular card where there is a regular visit, or if it's an emergency card where there's an emergency visit, right? So these two things you have to keep in mind. Now, again, when you've got to know what kind of card it is, whether it is a regular card or an emergency card, and when you have got to know these two things, you have to make sure that whether it's a review visit or if it's a first time visit. Now, don't get confused when I say first time visit, because first time visit can mean two things. Either you have never met the person, or you met the person, but the complaint that they have come to you with today is a new one. All right, so let's make things clear. What kind of clinic it is, what kind of card it is. If it's an emergency card or a review card or a simple regular card, then in these two things, whether it's a review visit or a new visit. All right, these things are really important that you need to keep in mind, because if you do not keep this in mind, then the conversation that you'd be carrying out would set a different tone, and we don't want that. All right, so you can see here that this is a suburban clinic. Now let's read the scenario. This is a deck from 2014. I have chose this a file that I've sent you. This file has all kinds of cards. I mean, it has all types of cards. So no matter what card they choose on exam day, you would know what kind of setting it is, what kind of scenarios might be there. There are different scenarios in this deck. All right. So let's just read this. We guys are doctors, so I'll be reading the doctor part first. This 50-year-old patient was recently diagnosed with Parkinson's disease. You prescribed L-Dopa, which is levodopa and carbidopa, but the patient is reluctant to continue with it, even though she is having muscle spasms in the left foot and cannot swing her arms. As she has no tremors, she is keen to try alternative therapies and asks about them instead of taking the prescribed drugs. Now, can anybody tell me what the scenario means? I mean, what's happening? And did you prescribe them? Or this is a new case? Is it an emergency case? If it's a review, is it? What's happening in the scenario? Because when you read the introduction, this is your introduction, it's really important to understand that. And you'd be given 3 minutes. With practice, you can definitely do it. So can anybody voluntarily tell me what's happening in the introduction? Like, what is the scenario? Anyone? Can you guys hear me? I hope I'm not talking to myself in here.
Yeah, could you repeat the question, please?
I'm saying, can you tell me what's happening in the scenario, the introduction, where we are doctors and they have presented us a scenario? So what's happening? Is this a regular visit, or is it an emergency visit? Is it a review visit? Do we know the patient from previous, or it's altogether a new case?
It seems it's recently diagnosed. It seems the patient is new.
Okay, the patient is new. All right. Okay, and is it an emergency one, or yeah?
It's a clinic. Please. It's not emergency. The patient recently diagnosed with Parkinson's disease, and the doctor now prescribed him medication. But the patient doesn't want this medication, even though he has the symptoms of Parkinson's disease.
That is great. You did great. You all did great. And that's what is exactly happening. So in this scenario, what is happening is that the person has been diagnosed with the disease and you prescribe them, right? That means that you know the person, right? So you know the person, this is your patient, and he was diagnosed with Parkinson's, but he doesn't want to take the drug. He wants to try something alternative to it, right? So that is your scenario, right? So now we're going to read the tasks. There are 5 tasks in here, right? So encourage her to persist with L-DOPA by explaining the importance of the medication and how it will improve the prognosis. That's your first task. You have to tell them, because this seems like that the patient would be reluctant, right? One more thing that you have to notice is that whether the scenario that you're given you are provided with is a regular one, like it's a regular information session, you're informing them about something, or there is a reluctant patient, because most of the times in OET they'll send you reluctant patients. That's the same case with step 2 CS, which they have abolished now, step 2 CS or PLAB 2. You know, they would send you patients which are reluctant. That's what they're training you for, basically. So this is where the patient would be reluctant. This is why we are encouraging him to take in the medication, right? That's your first task, that you encourage them. The second task is explain what PD is, that is Parkinson's disease is. It is a degenerative disorder of the central nervous system, and what happens neurologically, that is, often impairs the motor skills of speech and other functions, right? That's your second scenario. We're explaining to them what this disease is. The third task is explain that the causes of PD may be due to head trauma, exposure to toxins, or simply unknown. Now, most of us are confused as in, should we explain each task individually, or we should just rephrase the wording and say some of the words in the task and move on with it. I'll tell you what to do, but just keep these things in mind, is that that OET is a very simple exam, right? It's simpler than TOEFL, IELTS, and they're speaking as one of the very simpler subsets. Their most difficult subset, is reading, right? So you need to focus more on that, right? But still, we're doing speaking sessions, so I'm just going to tell you that this is one of the easiest ones. You need to practice a little bit and you'll be good to go. So here things are very clear. We are having a reluctant patient and we're telling them what to do and how to do and when to do. And we're also telling them and we're convincing them to take the medication that we prescribe them, right? So this is your third task, right? The fourth task says recommend physiotherapy and explain ways in which it can help. That is, example with movement, initiating gait, pain, breathing. So we're going to send them to physiotherapist as well. Answer questions about the benefits of exercise, acupuncture, massage, but emphasize these are not alternatives to the medication. Now, this is what our tasks are. I do not recommend that you read the patient's part. I always want you to read the doctor's part, but if you are, because we're doing it right now, so I'll be telling you, I'll be reading the patient's part as well, and then we would be practicing with each one of you, right? So be ready. Now I'm just going to read the patient's part. Now this is the person just sitting in front of you on your exam day. Always when you prepare, make sure that you create the environment in which you're practicing that of exam, right? Like create exam like environment, because that can help your brain understand what you need to do in time of crisis if you forget things. All right, so you are 50 years old and have recently been diagnosed with Parkinson's disease, which has caused stiffness and movement difficulties. You cannot swing your arms and are getting muscle spasms, especially in your left foot. You do not have a tremor at this stage. The doctor has put you on a drug, but you are keen to try alternatives so you can cease the medication. Now you see, that person has been ordered to do a role play in which the person would be reluctant. You have been told that the person is reluctant and we want them to take the medication, even though he wants to try alternative therapies. The first task for the patient is explain that you do not like taking drugs. I hope you guys are following me. If you have any questions, you can ask at any point. If you want me to repeat something, you can ask that too. Find out why the doctor thinks he needs to persevere, and find out what exactly Parkinson's disease is, what causes it, how does it affect your brain. So that's what we did, right? The simple explanation there. Find out if there is anything else that would help. Example, exercise, acupuncture, or massage. Be difficult to convince. See, this is your task. Be difficult to convince, but eventually reluctantly agree to stay on the drug. All right, so this is their task. This is our task. I give you guys 1 more minute to just read this doctor's task and type your name in the group session so that I can see who wants to be the doctor first. I'll be the patient. You guys will be the doctors. So whoever wants to start first can please type their name so that we can begin. All right. This was an introduction to it. If you guys have any questions at any point, do ask and do type your name so that I can start practicing with you guys. For those who have just joined in, I want you to read the task, Doctor's Part for Parkinson's, and we would begin practice. Please type your names in there so that I can call you out and we can begin. Great. So who wants to go first? Okay. Anyone wants to volunteer? So Dr. Zishan. All right, Dr. Zishan, should we start? You're going to be the doctor, I'd be the patient. Should we start?
Yes, doctor.
All right, let's start. I'll be timing you 5 minutes, and then as that stops, I'll stop you. All right, so let's begin.
Okay. Good afternoon.
Yes, please continue. Please continue.
Yes, good afternoon. My name is Dr. Zishan and I'm your treating physician here. May I know your name and age?
Yes, doctor, my name is Sam and I'm 48 years old.
Okay, Sam. What brings you here today?
All right, okay. Dr. Zishan, as we go with this conversation, I'd be definitely pointing things out at you. The first thing is that you know the person already, right? And you know that what they're here for.